each of you to pause, reflect on the significance of this moment, and offer gratitude for the positive impact this space will have in the communities we serve as I offer this blessing. God, while we may call you by many names or not at all, in this moment, we collectively gather with gratitude for the Virginia Commonwealth University Health System Adult Outpatient Pavilion. I ask your blessing upon this space filled with compassionate, patient-centered care. May each patient enter this space feeling seen and safe, and may they leave this space feeling heard and cared for, body, mind, and spirit. May each team member feel valued and appreciated as they partner with compassionate providers. In this space, may there be wisdom to see and set boundaries, courage to move forward when there is fear and doubt, physical and emotional strength to persevere in the face of challenges, a sense of community that brings encouragement, well-being, and resilience, and a hope that convinces each patient that they do not journey alone, and convinces each team member and provider that their care for others really does matter. May it be so, and amen.
Thank you so much, Marilyn, for that beautiful blessing of the VCU AOP. Welcome to our virtual ribbon-cutting celebration of the VCU Health Adult Outpatient Pavilion. I'm so grateful for the unstoppable commitment and dedication of our thousands of team members, project partners, and community supporters who have helped us to get to this wonderful milestone that we've now reached. You know, I recall sitting in a restaurant not very far from here about 6-7 years ago, planning this project with colleagues at that restaurant. We sat there and literally drew what we thought could be on napkins. We didn't have paper that day. And now I say, wow, how could it possibly turn out so beautifully? I'm so proud of everything that I see today. The Adult Outpatient Pavilion is a pivotal chapter in our mission to provide greater access to the very best world-class care. This is a space that fosters learning, collaboration, healing, and research that will help us to find causes and cures. This grand facility will house most of our adult outpatient clinics and will prominently house our VCU Massey Cancer Center, a VCU entity that really helped drive so much of our planning and is such an important part of our identity in this important facility. We provide care to everyone, but very importantly, to those with the most complex care needs. Our goal is the very best possible patient experience in the United States of America. This is our largest and most ambitious visionary building project that we've ever had at Virginia Commonwealth University. It's been guided by the mission to serve all human beings with all needs. We wanted to create a welcoming place that's accessible to our patients, their caregivers, and the VCU community. A Richmond and Mid-Atlantic healthcare icon. That's what this has become. Today's ribbon cutting signifies a milestone in our quest to provide our patients, their families, and our caregivers with the very most important and very best tools that they need to live their best and healthiest lives. Along with One VCU, our facility plan, their voices and their visions have guided our planning process in spectacular ways, and it shows in everything that I see here. To all of you, I say thank you for this important partnership. It took all of us to make this grand facility possible. AOP care providers will continue to treat and heal with great empathy in a beautiful, peaceful new setting that has been very well thought out by so many people. The AOP is an embodiment of a promise. It's a promise to be the very best in healthcare answers to all people, including those who have run out of answers. It reflects our promise to make healthcare accessible to everyone who needs us. We're reaching our goal to achieve the top decile for patient experience at VCU, and that will be among all hospitals in the country. You'll hear more about patient care from Rudene Mercer-Haynes. She's an amazing human being, a great friend, and we're so fortunate to have her here to work together with us. And now, I welcome our program MC, Dr. Doug Arthur, our chair of Radiation Oncology. He'll be our MC, or Master of Ceremonies, today for this wonderful, important, momentous occasion. Doug?
Thank you, President Rao. I'm thankful to be part of this pivotal moment and to have been asked to introduce our speakers today. Today, we will hear perspectives from several people representing a variety of backgrounds and experiences. When I think back to that first planning meeting, it's amazing that we're standing here in this spectacular space, ready to take care of patients. From a cancer care perspective, this journey started decades ago with Dr. Walter Lawrence transitioning to Dr. Gordon Ginder and now to Dr. Robert Winn, who will lead us to bringing this building to life. Many clinicians and staff have contributed over the decades to get us where we are today, but it would be a mistake not to fully recognize that despite the changes in the people over the decades, the Massey family has been with us throughout the journey with their enthusiasm and support. From the beginning of this building project, I've been allowed the opportunity to play a small role, which provided me the opportunity to witness the work of hundreds of people contributing to the design, build, and now operation of this spectacular space. Through all of the suggestions and creativity, Deborah Davis, with Shirley Gibson and Jake Hughes, have kept everybody focused on the patient and the patient experience. It took to not only listening to our patients, but also the community as a whole, our clinicians, our staff, and even looking outside of Richmond for inspiration. It has taken a tremendous amount of dedication, work, and sweat to move us forward to where we are today, and now we stand ready to bring this wonderful building to life. I'd like to thank our construction project partners who've been arm in arm with us throughout, JLL, HDR, and Hurricane. We couldn't have done this without this incredible dream team working so hard to bring this vision to life. To talk more about this vision and inspiration, I would like to welcome Dr. Art Kellerman, Senior Vice President for VCU Health Sciences and CEO of the VCU Health System. Dr. Kellerman?
Thank you, Dr. Arthur. When we began reimagining the future of outpatient care for this region, we had three goals in mind: make care easy to access, provide excellent customer service, and create a nurturing environment that welcomes patients from the moment they arrive until the moment they depart. Every square foot of the adult outpatient pavilion is carefully designed with these three goals in mind. In this era of patient-centered care, we've reimagined what care spaces should look like and feel like. The layout of each floor of the building will create a streamlined experience for our patients, their family, and our healthcare team. The careful thinking that we've invested to optimize clinical workflows and the cutting-edge technology we've installed will give us capabilities that were previously unavailable in this region. VCU patients have always appreciated the thoughtful care they receive from our doctors and nurses. Now, they'll have a state-of-the-art facility that is purpose-built to make the delivery of that care as easy and as seamless as possible. As one of our nation's leading academic medical centers, we always brought a multidisciplinary approach to what we do. Now, we have an amazing new building that'll inspire our healthcare team members, our researchers, and our educators to do their best every day and discover how to make care even better in the future. When patients come to the Pavilion, we hope they'll notice the little things that can make a big difference. How easy it is to park in the same building where you're going to have your appointment. The way we brought the outside in. The natural interaction between building materials, paint colors, and artwork along the walls, and even on some ceilings, to surround our guests in a calm and healing space. A cafe will provide a moment of comfort with a hot drink and a quiet space to talk with friends and family members. We hope that this beautiful new building, with spectacular views in every direction, fosters healing of body, mind, and spirit. When you come for an appointment or a visit, please take note of the stunning abstract paintings produced by well-known local artist Dr. Baxter Perkinson. You'll find them throughout the building. All of these paintings were created and generously donated by Dr. Perkinson to grace this pavilion. We're grateful for the hard work of our builder, contractors, and the many incredible team members who have brought us to this moment. We can't wait to welcome you to our new home and your new home for outpatient care. Now, I'd like to introduce Dr. Rob Winn, Director of VCU's Massey Cancer Center.
Thank you, Dr. Kellerman. We are excited to be opening a dedicated oncology space for VCU Massey Cancer Center that will consolidate the majority of our cancer services downtown. Because of the advances that the NCI-designated cancer centers, like Massey, have made in treating cancer, oncology care is increasingly provided in the outpatient setting. And this new space, well, it represents Massey's commitment to the best in our outpatient cancer care. The new technology we're bringing in allows us to offer so much more to so many more people than we ever have before. It widens the scale and the scope of the folks we're trying to serve. The more advanced treatments and technologies we can offer, the more we can reach additional populations even better. Access to the latest, most innovative technology not only provides more advanced treatment options for our patients, but it also helps VCU Health attract the best and the brightest minds to Richmond, who also, by the way, want to help provide these treatments and research to even more advancements to improve the health of our community. The new technology at the Adult Outpatient Pavilion will also support the expansion of VCU Health's clinical trials. By scaling these trials, we will further our reach and impact across a diverse group of patients and continue to raise the standard of care for all. This new space supports Massey's vision of a future without cancer. It will improve our community's access to comprehensive cancer care, and it'll allow us to provide our patients the welcoming and healing environment that they deserve. We have our own VCU Massey Cancer Center lobby that will have a welcoming desk. As they enter into the building, they're going to have their own elevator, separating the experience between the oncology and non-oncology patients. And as they come up through the oncology floors to see the different specialists, as well as these infusion centers, as well as our radiologists, they're all going to be linked and separated in their own unique experience with greater convenience, including, by the way, a well-needed 1,000 spot parking spaces right in this building. With sunlight-filled areas, these facilities have been designed with our patients' input. Thank you for celebrating this momentous occasion and next steps in better serving our community. Now, I would like to introduce Rudene Mercer-Haynes, Rudene is a great advocate for the Cancer Center. She is also just an amazing human being. I thank you for your support of VCU Massey, and thank you for joining us today.
For years, I'd heard about the life-changing work of VCU Massey Cancer Center and the innovative, patient-centered treatment that it provided. For years, I had also heard of the cutting-edge research happening within its walls to address health disparities, and the renowned physicians, researchers, and care teams doing what they could to imagine a future without cancer for everyone. However, the indescribable treasure of VCU Massey Cancer Center only became real to me when I received my own diagnosis of early-stage breast cancer 1 year ago today. Hearing a doctor say that you have cancer invokes a torrent of emotions that you're never quite prepared for. I remember being flooded with feelings of shame, sadness, and uncertainty when I was diagnosed. While I was overwhelmed with all that I was feeling at the time, from day one of my diagnosis, I found affirmation, reassurance, and just sheer sanity from my care team at Massey. The emotional roller coaster that I mentioned is just one of the impacts of a cancer diagnosis. But another consequence is that your life suddenly gets turned upside down, around, and sideways, with the number one focus being conquering cancer. Scheduling countless life-saving follow-up appointments, diagnostic exams, and treatment planning sessions with oncologists, radiologists, and surgeons can be disruptive to not only the life of the cancer patient, but the lives of her family and caregivers. In this time of what can be chaos and upheaval, it is incredibly important that a cancer center is responsive to the particular needs of the patients and recognizes the importance of accessibility to life-saving treatment for everyone, regardless of socioeconomic status. It also needs to create a calming space that is sensitive to the evolving emotional and psychological needs of its patients and their caregivers, and at the same time does its best to minimize the inconveniences and stressors of scheduling and getting to appointments on time. VCU Massey Cancer Center has always been focused on making cancer care accessible and responsive to its patients' needs. And the Massey Cancer Center at the Adult Outpatient Pavilion is a further embodiment of this mission. The Adult Outpatient Pavilion provides support and encouragement in its treatment facilities that help to lighten the burden of cancer diagnosis and treatment. This building literally and figuratively provides a brighter outlook, allowing more natural light for patients during chemotherapy treatment. Recognizing that other aspects of a cancer patient's life doesn't stop with a diagnosis, this new pavilion provides areas for multitasking and at the same time provides space for rest, reflection, and mindfulness with enhanced privacy in treatment areas. As a community, we are incredibly fortunate to have VCU Massey Cancer Center, a National Cancer Institute designated cancer center here in Richmond. Having access to the highest quality of cancer care improves the lives and livelihoods of millions of Virginians and creates a healthier future for generations to come. Through community engagement and outreach, VCU Massey Cancer Center seeks to alleviate the cancer burden and health inequities on marginalized communities, which benefits us all. I have a unique view of VCU Massey Cancer Center, serving on the governing and philanthropic board for VCU Massey Cancer Center, and co-founding the Facts and Faith Friday initiative with Dr. Winn and Pastor Gray of Fifth Street Baptist Church, while at the same time being a beneficiary, a very blessed beneficiary, of its life-enhancing care and treatment as a patient. I see and understand firsthand how VCU's collaborative and community-focused approach enhances the patient experience and helps propel us all forward to achieving a future without cancer. Thank you for allowing me to play a small part in today's ribbon cutting ceremony, and now I'll turn the program back to Dr. Arthur.
Thank you, Rudene. for sharing your story and trusting us with your care. It's patients like you that have inspired and helped us to bring this family-centered, friendly, and accessible project to life. I'd like to now introduce Dr. Tom Yackel, President of VCU Health's Physician Practice and Ambulatory Operations. Dr. Yackel?
Thank you, Dr. Arthur. As an academic medical center, we prioritize serving our patients with the best tools available. Our providers want their patients to be treated in the most efficient manner with the highest quality of care. With a new building that houses more advanced capabilities and technology, as well as the best level of treatment and educational knowledge we already have at VCU Health, I rest easy knowing the patients will have the best outcomes. Access to the latest, most innovative technology not only provides more advanced treatment options for our patients, it also helps VCU Health attract the best and brightest minds to Richmond who want to help provide these treatments and research, even more advancements to improve the health of our community. And as Dr. Winn mentioned, the new technology that the AOP also supports the expansion of VCU Health's clinical trials. By scaling these trials, we will further our research and impact across a diverse group of patients and continue to raise the standard of care. Perhaps one of the greatest services we've provided to our clinicians and patients with this new building is bringing 25 outpatient specialties together, including neurology, urology, oncology, dermatology, orthopedics, obstetrics and gynecology, among others, all under one roof. The proximity of services allows patients to flow through their care journey with ease and ensures clinical collaboration through intentional design. Our clinicians are now all in a physically aligned space, so it opens the door to a more integrated care flow model in an even grander way, since the space itself is spectacular. These upgrades elevate the new adult outpatient pavilion beyond a new facility. It's a tangible demonstration of the way healthcare should be. Through cutting-edge technology and thoughtful treatment spaces for clinicians and patients, VCU Health will continue to provide patient-centered, pioneering medicine and research for the greater Richmond community. Now, I'd like to introduce and welcome my colleague, Tracy Fry Longoria, VCU Health's VP of Ambulatory Operations.
Thank you so much, Dr. Yackel. When designing a product or service, we have to keep in mind that people don't only notice how the thing works or looks, they notice first impressions, interactions with staff, intuitiveness, and connection to the digital world. People remember experiences. For all of our team members, providing an environment where they can surround the patient as a team is really what is so inspiring about this building. Every floor offers dedicated spaces for patients and clinicians to meet with one another, to bring their friends or families for consultations, or have multidisciplinary clinical consultations. I wish I could name all of the team members who have worked so hard to bring this dream to life, but we'd never get to our ribbon cutting. Thank you, everyone, and I cannot wait to welcome you to your new home for outpatient care. Now I'd like to invite Dr. Rao back for a few closing remarks.
I have so enjoyed taking all of this in today, not just the beautiful words of my colleagues and friends, but also this wonderful facility and what it represents as a place for all of our people. It's so great. It represents an enormous commitment to all of the things that we stand for in our critical missions. It's a peaceful place. It's a place that in so many ways reflects all of the great thinking of literally thousands of people, including hundreds of my colleagues who have worked together to make this happen. This now represents a place where lives will be enhanced, lives will be given a chance, and lives will be saved. I want to thank all of you for joining us for this important ribbon cutting of one of VCU's largest ever facilities, and perhaps one of its most important facilities, important for so many people's lives. Thank you. And now, let's go and cut this ribbon.